I'm Janet Layton, I'm a social worker, and I work 1 day a week at Bullinah Aboriginal Medical Service, and Bullinah is the name of Bullinah in the Bundjalung language, okay? I'm a Gumbaynggirr elder myself, but from the western side of Gumbaynggirr country, which is the Dorrigo Ranges, God's country. So we all think our country is God country, and we're all one people, so it doesn't matter, does it? I've been doing a lot in the mental health area for a very long time. I also work at Brisbane Royal Hospital, but I'm in an administrative role there where I manage an after-hours Indigenous hospital liaison service to the 4 hospitals of Metro North. So it's a very big hospital, encounters lots of people, whether they're Indigenous or not, and I see a lot of people who are suicidal. I assist with the psychiatric emergency team when they ask me, but it's not part of my normal role. But because there are so few qualified Aboriginal people, that's why I get asked, and because I work the weekends. All right. So I'd like to just set the scene a little bit with the mental health field. So I've taken these stats off the Australian Institute of Health and Welfare. Oh, I forgot to say I've been working in health nearly all of my life. I started off life as a young graduate from the University of New South Wales and worked in the first Department of Aboriginal Affairs in Canberra with Charlie Perkins. That was just after the right to vote and those kinds of things that happened in those days. And the early setup of funding for Aboriginal services all over the country. So it was a very large job. Just talking about mental health, 45% of the population will have a mental health experience at least once in their lifetime. So that's a very big statistics. It's also the reason why the federal government has decided to put a very substantial amount of money into mental health, and I think it was the last financial year that they decided to do that. But it's interesting looking at the website. There's not much information about how that's been rolled out at grassroots level. 15 to 44 years, they're the highest users of mental health services, and most of their needs relate to anxiety and depression, depression being higher. And all of those things are linked back to socioeconomic disadvantage, all right? So that's across the board, it's not just Indigenous specific. All right, so I'm going to skip across a few more things. Mental health is the third highest disease category, and I've just read you 23.5% of depression and 26% anxiety. So why do we have these kind of figures? Anybody got any suggestions?
Society.
That's it. That's hitting the nail on the head. Society has changed so much, even in the last 50 years. Go back 100 years, go to the Industrial Revolution. And population numbers continue to increase, and it becomes harder and harder for people to be able to survive because Western culture is set up on a very economic basis. And that's one of the things that makes it contrast so differently to Indigenous cultures, where people are working on survival of the group, not the survival of the individual. And it makes a huge difference because Indigenous people take care of each other. In the wider society, people don't tend to do that. I'm not saying all cultures doing it, I'm just saying that if you look at it from the mental health perspective, you can see that there are a hell of a lot of people out there who have nothing. They get into their problems with their condition and their families can no longer cope with them. They're living rough, they're using drugs, and they're begging off the streets. They're also being attacked where they live, and their lives are just really waiting to die. Okay. One of the interesting things I found in the site was that GPs provide more services than anyone. So the figures were quite interesting that total GP services for 2017-18 on a Medicare subsidy were 660,446, which is 8.3% of the Medicare funding. Psychologists were 145,140. Huge gap there, and you've got to ask why. Other allied health services, 222, 1,596. And for Indigenous people, 200. Okay. Sorry, that was other psychological services. The other one was psychiatrists. Other allied health, 24,846. Indigenous people constituted 16. So the total number of people receiving Medicare support was 798,307, which was 10.1%. All right? So there continues to be a very large gap in the capacity of the system to service the need. All right? So what are we going to do about it? All right? So it's very important to look at the successes and the failures of whoever is working within the field. Okay? One of the big factors, I think, is that, as someone has already identified, larger society is the main reason I think that people have lost those coping skills or didn't have them to start with. Okay, so if you look at a lot of people's upbringing, their socialisation, those earlier generations didn't learn the coping skills, meaning coping with life. All right, they didn't learn problem-solving skills. They didn't learn stress management. They didn't learn self-confidence and self-esteem. And that's a very hard basis from which to start, all right? So that when you're working with people in this field, it's very important to have a treatment plan that takes account of those things, and that's why treatment plans have to be holistic, all right? The difficulty of the system, as we've heard with somebody, I think Bullinah, they have a very comprehensive or holistic way of delivering services to people who are diabetic. But that same sort of holistic approach needs to be applied in the mental health area as well, because otherwise people are left short, okay? So other components of social health, the socioeconomic status. So clearly, if you're coming from a group that has a low socioeconomic status, you have to really work hard in the area of education to be able to make some progress. And when you're coming from families that are already poor, that is not easy, because the poorest people in our society, many of them don't have housing still. I'm 68 years old and I'm still hearing these kind of stats after all of these years, because governments have not been able to find the money to make a substantial increase in the housing stocks all over the country. Many years ago, when I was a young person, they brought out a thing called the Burdekin Report, which talked about homelessness amongst all people. And the stats from that were really dreadful. But we haven't seen much increase over the years. When you go into health service delivery areas, especially into the hospitals, you're seeing what they call homeless teams or the hot teams. And people work very hard to try and assist people to find accommodation. But if they don't have money, they can't get a place to stay. All right? They're forced to stay in the parks. And once they're in the parks, they have to find safe places to be so that they're not getting robbed, raped or beaten up. Recently I was travelling on the way to work into town, and someone spoke to me across the aisle and said, "I know who you are." He said, "I've seen you coming in here for years with your little bag and all the rest of it." And he was telling me that one of his friends had negotiated a deal with a very big car parking company around Royal Brisbane Hospital, which would allow homeless people to sleep in the car parks, and they would provide them with mattresses. And I thought, isn't that fantastic? Somebody cares. You know what I mean? Providing a mattress is not overly expensive, but it means a great deal to the people who are going to use them. All right? I'm hitting you with a few quite harsh realities here, because it's important for people to be aware of this information and to talk about it to others, to be influential in your own right, and to educate other people and to gain their commitment towards doing something. All right? I'm assuming that because we're all here, we have a strong and genuine social commitment to the care of others, not leaving them behind. All right. The other thing that I think is important in terms of social health is physical environment and the spiritual link. They're very important, and particularly for Aboriginal people, because our culture is always based on our relationship to land, all right? And that spiritual link is what gives us our identity, our sense of belonging, and our healing. Because in our culture, when you learn about the old ways and you meet the traditional owners, they're going to be talking to you about getting your feet on the earth, all right, and relating to the old stories that teach you about behaviour and give you lessons on how to cope, all right? Other cultures have those same stories, like Aesop's fables. All cultures have stories, but a lot of people don't learn about them. I have to say, when I was growing up, because my father was Aboriginal and my mother was Greek, I didn't know anything about all these other English things till I was well into my adulthood, and then I had to learn about them because of the nature of the work that I do. But it is important to look at those stories. It doesn't matter what culture they come from, it's to look for the meaning in it. The spiritual link, I think, is really important because with a lot of people who have mental health problems, whether they're depression and anxiety or more serious conditions, people have got no hope and they've got no faith. If people can redevelop or establish a spiritual link and a sense of belief, it gives them something to trust in, okay? My father always taught us when we were young to trust in the spirit. In our language it was Goya. And for myself, I talk to Goya. If I'm rolling into a car park, I'll say, Goya, please find me a parking spot. And my daughter will say to me, you're crazy, Mum. I say, listen. And I always get a car park. Okay? And it's the same with a lot of the old religions. It's that when you wake up in the morning, take time to say thank you for the day. And thank you for what we have, all right? And the same at the end of the day. Create that spiritual link for yourself and help others to do the same, all right? If you've got hope, then you've got a basis, you've got the motivation, you might as well say, to do things with your life. So earlier this year, I had to work with a patient in the emergency department who'd thrown himself into the Brisbane River. He'd been fished out by the police and brought to the hospital, and the consultant doctor rang me up and said, please come and see this patient. So I spent 2 hours listening to what he had to say, and then after that I said to him, do you want help? And he said, yes, I do. So we then talked about the kind of help that he needed and how he was going to get it. And then I documented all of those things for the psychiatric team. Is someone dinging me? And he then decided to, he was then able to recover emotionally from what happened. But prior to my arrival, he'd said to the consultant doctor, as soon as you discharge me from here, I'm going off to have another go. All right? So that's where people need to have help because they can't do it on their own. All right? So that leads me into my next point in regard to social health determinants, and that is having social integration into the society and engagement in the wider society. Now, that's easier said than done, and particularly when you're coming from a different cultural group. So for my people still feel that they're on the outside even after more than 150 years. So the issue is, how do we identify ways in which to change that? But at the same time, it's not just that individual case, it's the infrastructure in which our society operates. We need to improve the infrastructure so that there is a service to access and that it's not short term. I'm going to skip across all of this stuff because it's all very deep and meaningful, as you can see. But I need to just highlight things in your mind for further thought. Family integration is also really, really important. Thank you. Because a lot of people with mental health problems lose the support of their families. So I've also worked with non-Indigenous patients in a hospital ward, and quite a lot of them were schizophrenics. It would take 6 months just for doctors to be able to work out what kind of medications they ought to be having, let alone anything about what happens for them for the future, because the hospitals don't want them to be, they want patients to regard the hospital as a motel, and for patients it's about being in a safe place. As soon as they're out of the hospital, they don't feel safe. That means they feel alone, isolated. And we don't have any of those residential services that could be helpful anymore, although in the past when they did exist, they were horrible places for people to be put into. All right? Again, why is that? So in the case of one of the patients, I'd gotten him to the point where he was still hearing voices, but not as much. And he'd built up quite a lot of strength. I was lucky enough to get approval for him and another patient to go into a program for 12 months where they would get more intensive education and experiential situations to be able to live independently. So unfortunately, I had to leave that job just shortly after that time, and then I heard that that patient went right back to zero. So that's the difficulty, is people who have these serious illnesses need continuity in the services. Now, I'm not saying me as one individual, but somebody, all right? And the other thing that it's really important for patients to feel is someone who is very genuine about helping someone that they're working with, all right? So if you do any training at all in counselling and psychotherapy, there's the humanist school, I've forgotten his name now, but it's very important to be aware of those listening and rapport skills that are so important to working with people effectively, because if you can't gain a person's confidence within 30 to 45 minutes, it's very hard to gain that at a later time. All right? And the family, the personal, the other thing that's very important too is the personality of the individual. We all come into the world with our different styles of personality. Some people are going to be able to, not be so angry. If you're the angry kind of personality and more challenging, you're going to find it harder to get help than someone who's listening. I'm not saying you have to be a doormat to anybody, definitely not. But being able to engage and to do it in a way that's not angry is really important. Otherwise, the workers that are out there get isolated from that person and then develop an attitude. Now, our training says you're not supposed to do that. You're meant to be trained to be able to ride the wave of whatever might happen. But it doesn't necessarily mean that it works. All right? Another important element of people's social health is the kind of upbringing and mentoring they've had. So I mentioned earlier on, learning about problem-solving skills, learning how to cope when you're under pressure, learning how to find information, all those things, okay? And so ultimately that determines the kind of fit that people will have in the world. Sorry, how am I going for time? Am I? All right, I'll run. I'm sorry I'm hitting you with a whole lot of stuff, but I figured it was better to make the points and then leave people to think about it and to do some follow-up at a later time. All right, so I want to comment a little bit about mental health treatment in itself. And I think that, let me see my notes. All right, so really, when people are involved with a client, you're looking at the ability of the person to function. And what that takes is an accuracy in the diagnosis, targeting of a treatment plan, how medications are used, and the quality of the casework that's done with that person. All right? So in my experience, I always feel very perturbed when I see psychiatrists or see a person's diagnosis, because there are multiple diagnoses being suggested for a person, such as schizophrenia and bipolar, etc., etc. And I find that really confusing, because there are supposed to be different meanings to each of those terms. So does that mean that the doctors are confused? I don't know. I've tried to ask about it, but it's not a question they really like to engage in discussion with, all right? But to me, it's really important because it impacts on what doctors are going to do about the medication for the patient. And for the many patients I've worked with, people hate to take antidepressants or antipsychotics, antidepressants in particular, because they say that it makes them feel heavy, that they can't sense anything, makes them feel like they've got no control, no self-empowerment. And so what can we do about medications? All right? I know that for an Aboriginal way of doing things, going out into the bush is a very effective way of working with people, and it's taken many years, but the social work and psychotherapy professions have begun to integrate nature-based therapy and pet therapy into their work, and those are good things to do. Okay. Now, when it comes to the case management, this is my bugbear, because social workers, their function in life is to solve problems and to help the person to become empowered to do things for themselves. I think psychologists, their focus is more about how the mind is operating, what kind of processes, cognitive processes are either helpful or not helpful. And psychiatrists, of course, they're coming from a biomedical perspective. But that's why it's so important for everybody to work in multidisciplinary teams, along with all of the other staff that are involved with an individual patient. So the end result is a very comprehensive treatment plan. Having said that, when I look at all the patients that keep representing to the hospital or wherever they are, there's not enough attention given to reducing the stresses that are in people's lives. That's why social work is so important, because they can reduce the stresses in a person's life so that you get closer to that person's ordinary baseline, which is where doctors and psychologists can then pick up and start to work in a more accurate basis with that individual. All right? As you can see, I hope you're all thinking it while I'm saying it, but there's a lot of energy required for this stuff and a lot of lateral thinking needed as well. The other thing is frequency of monitoring. Oh, okay. All right, I'll run through the rest of my points. Frequency of monitoring and contact with the patient. Highly vulnerable people are not, seeing them once a week is not enough. And even when they move through into a less vulnerable state, they still need at least fortnightly contact with a caseworker. Of course, that's according to their ability to function independently. And I think it's very important for providers, meaning social workers, psychologists, whoever it may be, they have to be people who are very committed to the individual, because a lot of patients are very challenging personalities, and partly what's going on there is it's their illness. You can't take notice of the abuse, it's the illness. What can you do for them? And so you have to work harder to find solutions that are going to help that person. And good problem-solving skills are another important factor. My final point to wind up on is empowerment. Whatever we do always has to be about empowering the patient so that they can function for themselves. And so for myself, I always educate the patient about where you can get information on whatever the service is that you need, and then how do you get it. And then you help them to do that, and once they gain some skills, they can then begin to do it themselves and be more confident to operate independently. Thank you.